ambulance. Tell me exactly what's happened.
Yeah, I heard a big bang. I've come outside. There's a woman and a man come off a bike. The guy's in a pretty bad way, and the woman who came off was conscious, holding her arms.
Driver 1131.
Catch 501-131, thank you guys. Code 1, please. 2 patients involved, fell off a motorbike, pre-dislocation to the elbow. 2 patients, code 1.
131, affirmative. Unsure if they were wearing helmets, only can see one helmet now. Okay, so that adds a whole nother element to it.
Yeah, it does.
You have no walls, you have no windows, you have no crumple zone.
Motorcycle accidents make me anxious because I feel like there's so many things that can go wrong that we can't control. Someone not wearing a helmet on a motorbike, your body is what's taking the impact of the accident.
On such a public road, that makes me nervous. Oh, man.
So these patients are more likely to have major trauma. You need to prepare yourself for the worst.
On Australian roads, nearly a third of all serious injuries involve motorcyclists. They are 30 times more likely to die in a road accident than passengers in a car.
The first traffic accident I ever went to was horrific. The passenger of the vehicle was someone that I went to uni with, and he unfortunately passed away at the scene.
Divide and conquer?
Divide and conquer.
Yeah.
We got this.
You don't expect to rock up to an accident like that and see someone that you know. It's quite heartbreaking. It wasn't until I walked away and I got back to station that I think it really hit me. So that was a couple years ago now, and it's something that still sits with me.
That's a uniform I recognise.
A nurse on her way home from work has stopped at the scene and assessed the patient.
I just rocked up. He's removed his own helmet. Can't see any, obvious large bleeding.
Yeah.
Yes, 15, opening eyes spontaneously, answering questions, complaining of some brief pain bilaterally. Haven't been able to get him to move his legs, so I'm unsure whether that's pain or...
Okay. Where's your pain? In where? Your side. In your ribs? Yeah. Do you have any pain in your legs? A little bit. Okay.
The patient's symptoms indicate major trauma to his chest and back, with a high risk of spinal damage.
Did you hit your head? No. You don't know? Okay. What's going to happen, just so I can have a better look at you, is we're going to roll you onto your back and we're going to support you in that movement, okay? Eliza, can I just borrow your hands for 2 seconds?
Absolutely.
We're just going to see spine roll.
Is that pain there? No.
On 3. 1,
Yep.
2, 3.
Sorry, I just need to be able to see you more. Karen, can you open your eyes nice and wide for me?
Big eyes, big eyes.
As a new paramedic, I was nervous and I was very self-critical, and I thought everyone else was very critical of me.
Both reactive. Perfect. Oh, yeah, okay, sorry. Okay, I'm going to take that he's got some abdominal involvement.
When you're in the community or you're in the middle of the road, there's so many extra eyes on you, and that's a lot of extra pressure to put on you other than the pressure that you already put on yourself.
Are you okay? Yeah, you've got a bit of a bung elbow, hey. Alrighty. I'm just going to feel your pulse there. Okay. Yeah, all right. Were you wearing a helmet?
No.
Did you hit your head at all?
No.
No. Okay, you remember the whole thing?
Yeah, I blacked you out.
We recommend a trip to the hospital, okay? It's coming back in 2 seconds, lovely. Yeah, alrighty. 139, can we get another crew attached to this job, please? We've got 2 patients. One suspected spine injuries. The other with a dislocated elbow, and she was not wearing a helmet during the accident. Can we get them code 1, and can we also get a CCP attached as well, thanks?
Roger, have them to me, code 1.
Thank you. You're right.
You have to keep your head nice and still. Bring the whistle to your mouth.
Look, you've been in an accident today. It's quite likely you've injured yourself quite badly. We've got another crew coming so they can help you. So I recommend you just stay here, okay?
No, it's very hard.
Keep your head nice and still. Bring the whistle to your mouth.
Oh, come on.
I know it really hurts.
Paramedics CJ and Eliza are attending a motorbike crash in Wynnum, east of Brisbane. The driver has suspected spinal injuries and his passenger has dislocated her elbow.
Big breaths. Our backup is here. Hey guys. So this was the driver of a motorbike wearing a helmet, unknown speed, come around the corner and they've slid with query head strike, unable to really tell us the events. Was witnessed, hasn't really moved since. He's got some C4, C5 pain on palpation, quite tender on the right-hand side of his abdomen up into his ribs. If you guys could work on some pain management because he hasn't been good with the whistle.
Please call me a massage. It hurts.
At the minute, we're a little worried about your neck. Just try not to shake and nod your head.
In a motorcycle accident, these patients are more likely to have spinal injuries.
We are about to get you up off the ground. There's going to be a bit of a hardboard that comes up underneath you.
It definitely adds a degree of difficulty because they're more time critical and they need to get to hospital, but you need to move them slower.
You ready? Everyone on 3. 1, 2, 3. Hardboard. Perfect. 3.
You have to make sure that they're okay and do the best that you can, so it's a huge pressure.
2, 3. Pardon? She's trying to run her. Now you see the other side. She gone?
She's just run off.
Okay.
Do I have to go in the ambulance? Like if I say I don't want it. I'm okay.
Look, you got a dislocated elbow. I don't know, I wouldn't say that's okay.
That'll be all right.
It'll be all right. How's it going to get undislocated?
Is it okay if I see your arm? Is that okay?
Yeah.
Just have a quick look?
Yeah.
Yeah, see, that's pretty bad.
You've been in a motorbike accident, you've bumped your head. So obviously these are all really concerning things. If untreated, could lead to severe injury, even death. If we tell you need to go to hospital, it's not something we take lightly. It's something like, it means we're worried about you. With a dislocated elbow, if it doesn't get fixed, it can lead to permanent nerve damage, permanent bone damage. All could be fixed with just a quick trip up to hospital. You can pop it back into place and you could be on your way home tonight. Do you still want to go against medical advice?
Can I go now?
Yeah. Teammate, get that elbow looked at. Yeah. Can't help everyone, unfortunately. As much as we want to.
There we go. My main concern is just ongoing pain management. Obviously, it's quite bumpy when we're moving around, and keeping an eye on that possible pneumothorax, making sure it doesn't develop further. Are you in line with that?
Yeah.
Cool.
Cool, you ready to go?
Yeah.
Working with CJ for the first time, I am super impressed. She just has this quiet confidence about her that really puts her co-workers and her patients at ease.
Since I started working as a paramedic, I would say that I have a lot more confidence.
I got hands.
So we can put it down now, yep. Yeah, there you go.
I like that I get to be the person that can be there to help, and you know that you've made an impact on their life. Because at the end of the day, that's all that really matters.
We have a 2 Alpha.
Yeah.
A 96-year-old female, conscious and breathing, who's had a fall. She has a split to her head. Run her up to hospital, make sure there's no sinister things happening inside her brain.
Yep.
Jobs with older people, they're a very complex patient.
They have a lot of comorbidities, they have a lot of health conditions that most younger people don't have already. So when you are treating them for something simple like a cut, there's a lot more in the background that can be affected. Knock, knock. My name's Aman and this is Ashley. What's your name?
Hello. Edna.
Edna. Edna, what's going on?
I was cleaning up the yard and I fell over on a root.
Yeah.
Hit my head.
Did you fall because you're dizzy or just because of the root?
No, just because of the root.
Okay. Do you have any pain?
Yeah.
Okay. What about in your neck? Is there any pain in your neck?
No,
Alrighty. What were you gardening?
just raking up leaves and rubbish.
Why didn't you get someone to do that for you?
I can always do that, but that's a pastime for me. I love gardening.
Oh, there you go, hey? Alrighty. How long have you lived here for?
66 years.
66 years. Are you ever gonna move?
96.
You're 96. You look 21 to me.
Yeah, but flattery won't get you anywhere, they say.
So Edna, I'm gonna put a pad on it so it doesn't bleed everywhere. I'll wrap it up. And then what hospital do you normally go to?
Hospital, I don't go to hospital.
I think you need to go to hospital.
If I haven't got to get it stitched, however.
Or they can glue it.
Do it myself well.
Alrighty. You can lean forward a little bit for me. Elderly are very stoic to a fault. I think they're very strong to a fault. Whereas sometimes you can't just get on with it, you do need some help. We'll need to go to the hospital for a full assessment. Not too tired?
Heavy.
Yeah. Sorry. In the fear of that infection can start causing a lot more issues.
I did all the yard and then had a knock off and then I'd fall.
Yeah, I know.
Oh,
Do you reckon we can take a stand and I'll see how you're standing and make sure your hips are all right? How's that?
all right.
You're pretty tall.
Tall.
Yeah.
5'3", that's all.
5 foot nothing. All right. Did you want me to carry your bag for you? Here. When I go see elderly patients, I do think of my grandmother.
But those roots over there,
Oh, yeah, I gotcha.
there from that big Norfolk pine.
I gotcha. My grandmother has had a lot of influence through my younger years, teaching a lot about her life lessons and going through hardships, you staying strong to yourself, having that one foot after the other. Were you ever married?
I married my husband, gone 38 years though, he died.
I'm sorry to hear that. Was he a good man?
Of course he was. I didn't bother getting married again, 58. None as good as him.
Not as good as him.
No,
How old are you again?
97 in July. Taken from my mother, because she was Aboriginal.
Hey?
Stolen generation.
Oh, your mum was stolen generation.
I was.
Oh, you were stolen generation.
They were taken from Mum.
Yeah. Was it because you had fair skin?
I've got fair skin now,
Yeah.
but she was Aboriginal.
Yeah. My grandmother was part of the stolen generation. But she doesn't talk about it much.
No, well, Mum had 4 children, all taken.
Yeah. They take you somewhere else? Where they take you?
Salvation Army home at Geronga.
Yeah. Was there a bunch of girls there?
50.
50. I assume they didn't treat you too nice there? No. I'm sorry to hear that.
If you were just there when you're 8 or 9, why would you be happy?
Yeah, I know. Where's your Aboriginal descent from?
Mackay, somewhere in the north.
Mackay?
I don't even know where I was born because I was taken off upset.
Yeah. I'm very sorry that's happened to you. My grandmother was part of the stolen generation, and I think it hits harder because my grandmother never spoke about it. She got told never to talk about it. Is there any positive things about your childhood? Was there anything nice that happened in your childhood? No. Even asking about it and trying to learn about it from her, it was pretty much a no conversation. It was shut down quite quickly. So I could only imagine what my grandmother went through. May I ask you a personal question? Did you ever get to see your mum again?
Yeah.
Yeah?
I went and lived up the street from her when I left the girls' home.
Yeah. What age was
They
that?
told you to go at 15, and I had a job then.
Okay. You're pretty fit, healthy for your age. What's the secret?
Molasses.
Molasses? Oh, I don't like molasses.
That's what I have.
Every day?
Teaspoon every day. So
Did you ever smoke?
no, I don't smoke and drink.
Don't smoke, don't drink. And you reckon a teaspoon of molasses a day?
Yeah.
Good on you. That's all I can say.
Cool.
When I became a paramedic, I signed the contract when I was 20. To be honest, I didn't have much life experience. Listening to all these stories does shape me as a person. Just realizing that maybe there's a little bit more going on in the world rather than just my little universe I have. She's like literally the spitting image of the old saying, indigenous culture is like tea. Like no matter how much milk you put in the tea, you're still tea.
Yeah.
It's like when people say well, you don't look black. It's like, well, you're still, you know what I mean?
Yeah.
No matter what percentage you are, you're still.
Still indigenous, right?
Yeah, 100%.
North of Brisbane, emergency services have been alerted to a patient having a psychotic episode at a public boat ramp. One police unit is already on scene. A second is en route. Andrew and Jan in car 238 are 10 minutes away.
So what are we actually going to?
Late 30s, stating that people are trying to kill him. Possibly a mental health breakdown. Police are on scene. Do you remember the guy we went to when I was a student? I reckon I must have had one stripe around that time.
Oh, you were like a deer in the headlights.
Oh, it was great.
Eyes were as big as dinner plates.
And I remember you saying, what do you want to do? And I was just like, I don't know. Because I think mental health, this kind of thing, you can't really be taught much. It's all about learning by feel and experience. He says people are trying to kill him and we have been upgraded because he's now unconscious. The fact that he's unconscious is worrying because it would suggest there's some sort of drugs or alcohol involved.
You don't often go to patients that are purely paranoid or delusional. It's usually accompanied with some sort of substance as well.
We're here.
North of Brisbane, paramedics Andrew and Jan have been called to a patient having a psychotic episode at a boat ramp. Due to public safety concerns, 2 police units are already on scene.
I think they're actually holding him down now. He's not unconscious.
The man has been handcuffed for safety.
I might just go and have a chat.
Yeah, okay, yeah.
Hello. Obviously not unconscious anymore. Good day. My name's Jan.
It's from the handcuffs. I'm not going to say it's fully shut down. No ribcage, no heart, no nothing. It's water pumping in. I'm telling you to do it now before I run out of time.
When we put up, he's just erratic, like super strong and just.
Somebody ring you?
Yeah, he's
all right.
really aggressive.
Have you had any drugs or alcohol today?
No, I can't believe I don't eat.
Okay. Where do you live?
Right here.
Right here? You got any family or anything nearby?
No, I'm dead.
No, you're dead, are you? Okay.
Yeah, you did say it earlier.
Oh, you had some meth? Okay, no worries. Do you have meth pretty regularly?
Well, we'll be after the tickets job taken.
When you have patients that are affected by ice, they're incredibly unpredictable. They can become incredibly strong. But you can have a patient that is quite small that requires 6 police officers to restrain them, and it's still unsafe.
Is it all right if I do your blood sugars and just see if your blood sugars are okay?
It'll be 0.
Okay. There's going to be a little sharp prick in your finger. Is that all right?
Yeah, but that's really...
Okay, good-o. All right, thank you. All right. Have you got any medical conditions?
Yeah, I'm dead.
Okay. That's a pretty bad one, isn't it? So what I'm going to do We're going to take you to the hospital, eh, and they can pronounce you dead there, hey? How's that sound?
No, I need to do it here.
I can't do it here. I can't get a doctor out
$1
here.
million to do it here.
Have you got $1 million?
Yes, I do.
Oh, my
I'm in the
God.
briefcase looking at you now.
Where's the briefcase? Quick, let's get that and go.
Oh, in the briefcase.
All right. Can we get you on that? Hang on, let me just get it down for you. Thank you. We're just going to get him up, chuck him on, and just see how he goes. That's the way. No, it's all right. Maybe down a little bit further.
Take first, you're real stupid.
Bum up here a bit. Just trying to get this bum down there. That's it. Good job. You're right there. Do you want to sit up a little bit, or you're okay?
No.
All right.
The patient's telling me that he's dead. And so if you can make light of the situation, have a smile with the police, that is what it takes to get you through that job.
You're going to lose your job, and that nigga's going to lose the job, and that lady's telling you to give me a paperwork and fist in the feet. I'm dead. I'm done.
You
Stick that machine on me. I bet so there's nothing.
I will, all right? I'm gonna take your blood pressure, okay? So can I...
There is any... What's the no pulse?
No pulse?
Oh, look, maybe it should work the first time. Look at that, no pulse.
I can feel your pulse in your wrist.
That's the water bottle with the little water pump keeping my body going.
Ah, okay.
Dealing with patients that are suffering delusions either through some sort of psychotic mental health problem or drug-induced can be incredibly complicated.
I'm gonna pop some dots on you, okay?
Because often they generally believe that what is going on is true.
Chop my whole chest, I'll give you 100 grand through the door.
What am I going to do? What am I going to do?
I'll give you 100 grand.
That would be very messy.
No,
It would be. Good to go?
I swear to God, I'll give you 100 grand while I turn around and get the blood for you.
Yeah, just tell me offside, I'm going to the hospital. Yeah,
Thank you.
Open the bank for it, please. Bye-bye, dickhead.
In some cases, I liken it to if you put a cat inside a cage and shake it, what that cat's going to come out like. That's what we have to deal with a patient's eyes affected.
I got your ECG. Does that count?
Yeah.
It actually looks pretty good.
Says I'm dead.
No, you see those little bits that go up and down?
Little bits.
That says that your heart's going really well.
Yeah.
It's going 1,000,000 miles an hour, but it's still going pretty good. Yeah.
With drugs like ice, the effect on the heart can result in significantly shortening their life.
Yeah, you never know, because he has been talking a little bit intermittently between passing away and coming back.
Jan is not just a sound clinician, but also, an empathetic paramedic as well. Is able to not just treat a patient physically, but also be able to emotionally assist them as well.
We're going to go into the hospital.
I'm so glad.
Yeah. So I really need you to pretend that you are dead. Because there's going to be sick people in there, okay? So I need you to really pretend to be dead, if you can.
Yeah, I'll be very well.
Okay, there'll be dead people. There is sick people in there, okay?
Can you take your handcuffs off for 50? Last chance to make money and not have a job.
You're too erratic, mate.
So yeah.
He's a dickhead.
Can you try to be dead for me?
I'm dead, exactly.
Jan?
Yes?
Can you go in and get triaged?
Yes.
They've got a spot sorted for us. So if you just want to go and see a triage nurse and get triaged?
Yep.
For me and my experience, drugs in general are just life enders.
How you going? Are you still dead? Mm-hmm. Yeah.
Well, I'm going to get your shoes and put them on the bed, hey? Is that all right? Mm-hmm. All right. Oh, my God, your shoes are all wet. Mm-hmm. You've been walking around in the water?
I'm dead.
Oh, yeah, you're dead. Remember, nice and quiet.
Hey, boys. Don't see you take your handcuffs off.
Good? Let's do it. Couple of bumps.
It's the end of your work, it's the end of your school, it's the end of your economic stability, it's the end of your family life. If you're getting into drugs, I promise you there are very few people who come out the other end successfully.
Ambulance, what's the town or suburb of the emergency?
Redland Bay. There's an older gentleman just across the road from our shop that's riding his mobility scooter and has flipped the scooter and he's on the ground.
Okay. How old is he?
Oh, late 80s.
Late 80s. Is he awake?
Yeah, but he's a bit disorientated. He can't really talk.
Yeah. They'll be there as soon as they can. If he gets worse in any way, call us back immediately on 000 for further instructions, okay?
Okay. Yeah,
Okay.
no worries. Thank you very much.
You're welcome.
In car 161, Jeff and Tamara are dispatched to the job. They're 10 minutes from scene with a single responder just ahead of them.
85-year-old male. Conscious of breathing. He's come off his mobility scooter. Mobility scooter is currently on his leg.
Mobility scooters are heavy.
Yeah.
85-year-old bones are not.
It's always concerning going to accidents involving elderly patients. Their bone density isn't as strong as, say, someone in their 20s or 30s, so even small impacts can cause significant fractures.
He's still down. Please don't walk there.
Let's have a look first.
Yeah, sounds good. We're on scene.
Hello. How long has he been on the ground for? 20 minutes. Was
Did you hit your head?
Was he trapped underneath it at any time?
No, that's basically how he fell.
Yeah. What's his name? Ray, is it? Perfect. Was he conscious the whole time?
Yes.
Perfect.
How heavy
is
is
it?
this thing?
It's quite heavy. We'll get him out.
We're going to try and get this out from out behind you, Ray, so that we can get you up.
Did you want me in there, Jeff?
I'm all right.
You sure?
Yep. You in pain anywhere? No?
With no apparent leg fractures, it's safe to move the patient.
Ready? Push through your feet. Is he on? I've still got him. Hold up. Don't fall forward. How did it happen? Did you just drive into the bush?
I tried to skid around the corner.
Just tried to skid around the corner. Tell me if there's any pain when I do this. No? That's all right? All right, we're going to get you on the bed, all right? Can you walk at all?
I've got Parkinson's.
Oh, okay.
In your own time. That's it.
You got him, Tim?
Yeah, I'm over here. I'm going to take this out.
The patient is 92 and lives in a nursing home 3 minutes away.
A little bit more, perfect. There you go.
To be a good paramedic, I think you need to have humility. I think you need to be caring. And if you can't talk to people, you can't do the job. Most of the job is communicating with people, and if you can't sit down and have a conversation with someone you've just met, it's going to be a difficult ride.
All right, we're going to have a clean-up of your wounds, all right? Now that you're on the bed, are you sore anywhere?
No.
No, no chest pain, headache, dizziness, nausea, nothing like that?
Nothing like that.
Perfect.
You don't need to take me to hospital.
I think we should, just to have someone look over you and make sure everything's okay. What do you reckon?
Unnecessary.
I mean, we can't make you go, but we can give you advice to go. So how about we clean up your wounds, we'll talk, and we'll see how we go, okay?
There's nurses down at the room.
Working with elderly patients, it makes me think about my grandparents. I guess I'm still lucky that I have grandparents who are, you know, completely sound of mind, well into their 80s and still live by themselves in their own home.
The worst possible outcome from this is that you go downhill and you get permanent injury or potentially death from an injury that we can't assess for properly, okay? And I know that probably doesn't scare you, but we still have to tell you, okay?
News of Ray's fall has reached his care home.
Ray,
Hello,
what happened?
I fell.
So at the moment, he just want to go to hospital. I'm confused. Yeah, that one will need to be changed.
Ray,
Might just pop the band.
I think due to the amount of wounds on you, you should go, mate, and get them all cleaned up, dressed, and come home. Go to the hospital and get checked. For me, please.
I'd rather go down with you.
No, I know you would, but can you go and get checked, please? This is 2 falls in 24 hours now. Go get checked. Will you go get checked?
No.
What about if I give you a kiss on the cheek? Will you go get checked?
Just pull that up. Just hold that.
I'll call your daughter. Hang on.
I think maintaining a level of patience was important. Time frame's not an issue, and I think that's how you manage your patients. You just got to remember that as long as I do my best for this person, then whether or not we sit here and talk for a short while or a long while doesn't matter.
Are you allergic to anything? Going to hospital?
Yeah.
Yeah.
Hey, someone wants to talk to you.
Who's that coming up?
Hi, Dad.
It's your daughter.
Hello, Leanne.
Dad, you've had an accident. That's not good, is it? I think they're concerned about the extent of the skin tears, Dad. You know, this isn't just a normal fall at home. This is a rolling the scooter.
Well, the scooter's all right, Dad.
More concerned about you than the scooter. You know, my thinking is Emily and the ambulance officers think that it's worthwhile this time, then maybe.
Keep rolling one.
Well, I'm almost convinced, but I don't think it's necessary.
Ray,
we don't
I don't
mind.
want to worry about you, please. I don't want to be panicking about your health and well-being, so will you please go and get checked? Because I do care about you and I want what's best for you. Please, just
But how can I refuse?
There you go. We'll go then. Hey?
Yeah, I think that's a fair decision, Dad. I think that's being considerate and fair for you and Emily as well.
All right, perfect. If anything changes, I'll let you know. But otherwise, we'll be in Marta, South Brisbane.
Thank you very much.
All right,
Great.
thank you.
Thank you. Great. Bye-bye.
See you later, Dad.
I'll see you. I'll talk to you later, Dad.
Okay.
Okay.
Thanks, guys.
Thank you very much. Sorry, mate. It's for the best, all right? Think of it as an outing for a few hours. We'll get you home in no time. Couple of belts.
You don't want to fall in.
Again.
No.
We all worry about our family getting older, but what you do about that, I guess, is what really matters. You just have to reassure them that it's going to be okay and you're going to take care of them one way or the other and support them through their life.
Your date of birth?
9th of the 6th.
9th of the 6th. What year?
Every year.
I really admire Jeff as a paramedic. Jeff treats elderly people as his equal and he creates a great relationship and rapport there in order to kind of make them feel comfortable, make them feel safe. Jeff just seems to bring out smiles with our elderly patients and brighten their day in any way that he can.
Your health is priority, I think your family say the same thing. That's all. I mean, I just treat you like you were one of my own, all right? So that's why I want you to get checked out.
You seem like a wife.
A wife?
Ambulance emergency. Tell me exactly what's happened. I've had an alarm activation.
Is that the alarm company?
Yep. I've tried to call the client on the phone with no voice contact, but I've managed to hear the client. She's calling, please help me.
You can hear her?
Yes, she just keeps saying, please help me. It sounds like she's a bit short of breath there. I'm not too sure what's going on there.
Alrighty.
She just keeps saying, please help me, please help me.
Okay, so I've got a car on the way to come out and help you.
423 Sydney. So we're going to an alarm.
Patient is calling for help, sounds short of breath.
City 4, 657, 657.
Laura and Blake are the closest ambulance, 8 minutes away.
This is a 90-year-old female. She's activated her medical alarm, but we haven't had any voice contact with the patient. I know from co-op that there's a lot of accidental activations. Having said that, though, it says in the note that she's calling out for help, so I would say it's potential for her having had a fall and not being able to get to the phone.
In Australia, 1 out of 7 people is aged 65 or older.
They might also be an invalid, bedridden or wheelchair bound. You don't know. You know, so
for sure.
We've got to take these things on board and think of all the possibilities.
More than 720,000 elderly Australians have received home support services of some kind in the past year.
We will take all the equipment with us. We'll take the 3 main kits.
Life pack and the drugs.
That's correct.
Yep. The thing that I'm most worried about is the unknown. It's not knowing what's going to come. It's the ambulance! And being able to deal with things as they happen. Hello!
Why are you here? Why have you come?
We had a call from your alarm company. Do you have pain? You sore anywhere?
No.
And what about your breathing? Can you breathe okay?
I'm breathing okay.
Yeah, good.
I'm not perfect.
What about your heart?
We'll do a quick assessment, do some basic blood pressure.
And your ECG, we'll do a 12 lead. So let's see what this one pops out. She's got some ECG changes. Right bundle branch block, and this one here, it's MI at the bottom there.
Yep. Is she on cardiac meds? I didn't see anything.
Have you ever had a heart attack before?
No. Our machine is telling us there might be something wrong with your heart.
The ECG shows a blockage in her heart. The patient needs urgent care to prevent a heart attack.
We're going to have to take you to hospital.
No!
I know.
No! My cat!
Your cat, I know.
I have my cat to look after.
You need to come to hospital.
No! No! I'm not sick!
Okay, it's all right.
No! Please! I love my cat more than myself!
Cat's going to be all right.
We're worried if we leave you here.
Laura? She's not really capable of making a responsible decision about her own health.
Blake calls Duty Operations Manager Paul to come and assist.
Inspector 66.
Yeah, g'day mate, how are you? Look, we've got a lady, she's in her 90s, she's got some ECG changes. I really want to take her to hospital because of the changes, but they're refusing. You can probably hear the anxiety going on in the background. She's very hard to control. So I'll see you when you get here.
Cover that, no problem, thanks.
The inspector is now on his way.
Okay, cool. Blake's going to get the bed and we're going to take you to the ambulance. Do you understand?
No!
Yes.
No!
It's okay. It's all right.
It's our responsibility to extract that patient. It's someone's mum, it's someone's dad, it's someone's sister, it's someone's important to someone else.
Please don't be upset.
Hello there, how are you? My name's Paul, and we're here to help. I have to take you to hospital. I know that you understand what I'm saying. Your oxygen levels are too low.
I don't care if I die.
I care. The law actually says that we have to look after you. Let's put your bed in terror. And then we'll look here. Your oxygen levels are too low.
I don't care if I die.
I care.
Laura, Blake and Duty Operations Manager Paul need to take an elderly patient to hospital. They suspect she might be having a heart attack. But she refuses to leave her house.
Blake's going to bring the bed into here, and we're going to help you because we have to.
Just try and relax. Try and relax.
Can I ask you something?
I'm just going to help you put your legs up. Hang on.
Can you open a tin for the cat?
We will feed the cat now before we go. I will. She'll be okay. We know she's very important. She'll be okay. Just try and calm down. Just take a deep breath.
And Laura's in the back with you, okay? You're going to be fine.
Yep.
So we've got our prints.
One of your concerns was the one of them came up as a STEMI.
Yeah, you're right, I know. I just then the anxiety's going to go again. Gonna give you some oxygen,
Listen,
okay?
I'm just gonna put these are gonna go in your nose, okay? It won't hurt. Just gonna give you a bit of oxygen.
You want to kill me.
It's okay.
He wants to
It's all
kill
right.
me.
Her anxieties are based on the fact that she spent a year in hospital. And she doesn't want to go back to hospital. She wants to stay at home. She wants to be, in home as much as possible. And it saddens me to have to do this to patients.
I understand.
These traumatic experiences, it's very important to keep the patient calm. If the patient's not calm, we can't do our job properly.
It's okay. I'm just gonna put this on your arm. It's not gonna hurt. I just need to put it on your arm, okay?
Having been a patient myself, I know how scary, how overwhelming it can be.
I am a human being like you.
I know, and listen, I know it's really difficult to understand at the moment, but we're doing the best thing for you.
If we came to your house and we didn't take you to hospital and something happened to you after we left, then we haven't done our job. We're here to help you. Okay, I know you're very upset. We left food out for your cat, okay? She is gonna be okay, and you will be back. Some people will cry, some people will yell and swear and get angry. You need to recognise the difference between somebody who's just scared and upset and is reacting in that way because of that, and someone who is actually, out to abuse you.
Can you understand how much I love my cat?
I know.
Can you understand how I feel?
I can, and I know you're very worried about your cat, but we're very worried about your health. It definitely takes a certain type of person to do this job. You could be the best clinician, you could be a doctor, but if you can't empathise with your patient, then you can't do this job. We have to get the tests, all right? Okay? I know, you're doing really well. Just try and relax, okay? Just sit back and relax.
Laura, you good to go?
Yeah. If you go to the job and you're nice to them, you make that little bit of effort to, feed the cat or put the baby to sleep, then you're doing your job.
Day one.
Day one. Graduated yesterday. Thank you.
Ambulance emergency, what town or suburb?
Harrisville. It's got this old man. He's had a fall, I think.
He fell, okay.
My wife and me helped him,
Right.
I was took him home. And he's got a bit of a cut on his head, he's an old man.
How old is he, just approximately?
He'll probably be 70 years, a bit older than 70.
All right, well, I'm going to send some help around there for him.
70-year-old male.
So, and what he's done, he's had his head?
He's fallen, he's lacerated his head.
That's no good.
Mosh and Karen have been dispatched to a 70-year-old man who has fallen and cut his head open.
We'll go and see what's going on with him and why he's had that fall.
Being called to the elderly, they are part of our society that are the most vulnerable.
Turn left to the next one.
And they need extra help, they need care and they need compassion.
Ambulance! Ambulance!
The risks to a patient that fall, we've got a head injury.
Can you see him or not?
Bleeding into the brain.
Because this door's not.
You potentially got spinal injuries. So you want to be able to go in there and start fixing.
You can't get access, could you start rescue?
We will get in. One way or the other, we will get in.
Can you see him or not?
Mosh and Karen are outside the home of an elderly man who's reportedly fallen and injured his head.
Is it open?
No.
We've got a gentleman here who's had a witness fall with a head injury. He's now not opening the door, so we can't gain access. Could you start rescue?
A head injury needs to be looked at as soon as possible for treatment.
We can't tell what's going on inside the brain. Even a really small bump to the head can cause a bleed in the brain.
Do you have a key?
A neighbour has a spare key to let Mosh and Karen inside.
But that's okay, we're going to go in. Thank you.
Hey, mate. Can you hear us?
Ambulance.
Tony. How are you, mate?
All right, I'm all good.
Listen,
You want to go there?
do you want to come in and have a chat? God love you. Come on. I won't take you. I just want to have a chat with you. Come on, mate. You got a pair of hospital red socks I noticed on.
I've been there all the time, that's why I don't want to go there.
That's okay. Let's go and have a chat in the kitchen.
Anyway,
My name's Carolyn. You want a hand?
no,
Come and grab a seat, darling.
you what's going on?
I just want to make sure you're okay.
Oh, Joe, very nice.
Come and sit down.
What about
Tony. Darling, do you remember having a fall? Do you remember what you hit your head on, darling?
Yes, footpath.
Oh, the footpath.
Oh, yeah.
Right, okay. And when you hit your head on the footpath, did you get yourself...
Sit down.
Sit down, Karen, sit down.
I'm doing as I'm told. Doesn't happen often, but there you go.
Do you take aspirin or any blood thinning medication?
Yes.
You do?
When a patient falls and hit their head and they're on blood thinning medication, the risk of them having a bleed into the brain is really high.
We just want to make sure that that's not bleeding on the inside, okay? And then we'll get you back here so you can finish that enormous lolly jar. Honestly, I'll just steal a couple of hours out of your day.
Yeah.
Come
Air
on.
conditioning.
Come on.
Yeah.
Great company.
No.
Cup of tea. When you were a younger man, what did you work as?
Policeman.
No.
Yeah, so what?
Listen, you being an ex-copper would understand that I've got a duty of care. Your neighbour saw you had a fall and I can see you've got a bit of bark off there.
Oh, so what?
Well, I'm just here to make sure you're okay.
You're a nice lady.
There we go.
Appreciate you.
Tony, do you mind if I take your blood pressure and your pulse and make sure you're okay? Nice and still for me.
I know what it is.
What is it?
45 over 90.
Is it?
Yes.
All right, what's the wager on that if it's not? What do I get if I'm right and you're not right? That's not going to cut the mustard. I'll tell you what. If it's not 45 on 90...
You're a smart lady.
Yes, if it's not 45 on 90...
Give me your hand, lovely. There we go.
Lovely.
Then we can negotiate. We can negotiate the hospital. How about that?
I'm not going there.
Come on, let's just do your blood pressure. Let me just do your blood pressure.
I'm not.
A lot of older residents don't particularly like going to the hospital. They are mindful that if they go there, they might not come home, or if they go there, they might be sent to a nursing home, and there's that fear of not coming home.
Well, you said 45 on 90, and I said if it's not that, then we can negotiate.
I'm pretty close.
You're not even anywhere near close.
Can I pop this in your ear?
Yes.
When was the last time you heard two females fussing over you? Sit back and enjoy.
Yeah.
Tony, I need to get your head scanned.
Get it down.
Oh, yeah, I know.
But I'm not going.
I need...
I am not going.
Tony, mate, listen to me. Tony, Karen's gonna get the bed out, and we're gonna walk out. We're gonna walk out to the car. I know you hate me right now.
I do.
That's okay. I can live with that. Come on. Come on.
All right, let's go.
All right. All right. Out you go. No, get out that door. Come on. I know that tactic. Right, good. Hang on, I'll give you a hand. No, no help? Can't help you. I know, we're bloody annoying, aren't we? Hey? Beautiful. Better airline. In, back tonight.
You won.
You won.
I love treating the elderly. If you listen and empathise with them, they will let you help.
So what rank did you get to as a copper? Commander. Jeez.
You did a good job, I'll tell you that.
Thank you.
You are good work.
It's all good.
Yeah, you gotta push it off to someone else. And then you,
No, we're going to drop you in there, get a scan done, and then you'll get home. Okay? That's it. That's all we're going to do. We'll take that off.
I've been a paramedic 32 years.
I'm coming out too.
I chose to do the profession for such a long time because making a difference for somebody at work, it makes me very happy. That's a great day for me.